everybody. This is the contrast-induced nephropathy. What happens when they get? Normally, the most common strategy to reduce the risk of contrast-induced nephropathy must be considered before the contrast exposure only. Peri-procedure hydration in chronic kidney disease patients by initiating IV fluid with 0.9% normal saline infusion at a rate of 1 ml per kg per hour for 6 to 12 hours before the procedure and continuing after the procedure. Some literature supports a sliding scale IV hydration protocol based on left ventricular end-diastolic pressure. So one is hydration, another is bicarbonate alkalizes the renal tubular fluid, preventing the free radical injury. Bicarbonate is most often given as an infusion of sodium bicarbonate at a rate of 3 ml per kg per hour an hour prior to the procedure, to be continued at a rate of 1 ml per kg per hour for 6 hours. See, this chronic contrast-induced nephropathy is normally a self-resolving process with renal function getting back to normal within 7 to 14 days of administration of contrast. Fewer than 1/3 of the patients may develop some level of residual renal impairment. Normally, we should see the risk factors like diabetes, any kidney injury, chronic kidney injury. We have to guide them because some people may require, if you give contrast in these patients, they may require dialysis after that. Complications associated with CIN. Acute renal failure, acute and chronic renal failure, hypersensitivity reaction, fluid overload, pulmonary edema, contrast-induced thyroid dysfunction. So, before when a patient we are giving contrast, we should take a consent. We should ask a history, whether they have diabetes, whether they have hypertension, whether they have heart problem, whether they have chronic kidney injury, renal. We have to tell them. So, non-diabetic patients without any risk factors, mostly nothing will happen. If they in this kidney, already they have chronic kidney injury, these people should be very careful. For them, chances of getting chronic contrast-induced nephropathy will be more, and going for dialysis also will be more. Thank you.